Hi everyone, my name is Kushi Kumar and I research a topic in cancer, specifically the hormone therapies and how they affect patients physically and mentally. I research in prostate cancer and breast cancer since they are most prominent in the US and globally. A little bit about me, I'm a junior at Niskuna High School living in New York, and I hope to pursue a career in the medical field when I'm older. So the introduction, my main question, what I was researching was how hormone therapies or HT affects cancer patients physically and mentally, specifically in breast and prostate cancer. The essential questions that I was looking for, but not the word was how HT is the best quote unquote treatment, or what is the best treatment for cancer, and how we can mitigate the effects of hormone therapy. And is there a difference between the types of hormone therapy treatments and which one is essentially better? The importance of this research paper was to identify the potential benefits, risks, and managing side effects of the patients, personalizing regimens, and supporting the patients in advancing research to improve outcomes and the quality of life. So my literature review was mostly articles from PubMed, American Cancer Society, and JSTOR. And this was a secondary literature review. This was qualitative data because you can't measure the symptoms of patients like muscle pain or nausea or dizziness. So everything was qualitative in this research paper. And I was also able to get stats from clinical trials. So we'll talk about what hormone therapy is. Hormone therapy uses hormones or hormone blocking agents to treat certain medical conditions, particularly used in hormone sensitive cancers, such as breast or prostate cancer. It is not a curative treatment, but it can help control cancer and reduce the risks of reoccurrence and improve survival rates in patients with these hormone-sensitive cancers. While effective, hormone therapy can also cause various side effects due to the intentional manipulation of hormone levels within one's body. Types of hormone therapies in both prostate and breast cancer. In breast cancer, there are SERMs, which are selective estrogen receptor modulators. An example is tamoxifen. They block estrogen from binding to estrogen receptors. Another one is AIs, or aromatase inhibitors. These inhibit enzyme aromatase that helps produce estrogen within one's body. And SERDs are selective estrogen receptor degraders, and it sounds exactly what it is. It binds and degrades an estrogen receptor. And lastly are gonadotropin releasing hormone agonists, which reduces luteinizing hormones and follicle stimulating hormones that suppress estrogen production in the ovaries. In prostate cancer, there's LHRH, which is luteinizing hormone releasing hormone agonists. These stimulate testosterone production, and after time, it leads to suppression of the testosterone, which is produced in the testes. And LHRH antagonists block the action of the LHRH, leading to rapid suppression of testosterone production without the initial surge that was in that's in agonists. So that's the difference between the two. And anti-androgens block the action of androgens, which are a group of sex hormones for male characteristics. An example is testosterone in prostate cancer cells by binding to androgen receptors. And androgen synthesis inhibitors inhibit enzymes involved in production of androgens, thereby reducing testosterone levels. And then the side effects that I found were that in breast cancer, there is increased anxiety and depression, hot flashes, brain fog, difficulty concentrating, fatigue, and muscle pain. And in prostate cancer, there's decreased libido, which is sexual desires, erectile dysfunction, fatigue, loss of muscle mass, memory problems, depression, and osteoporosis, which is the degradation of bone cells. The most notable thing that I found was that in breast cancer, there was a significant difference in AIs and SERMs. In AIs, there was increase in symptoms of mental issues such as anxiety and depression. Meanwhile, in SERMs, there was more physical symptoms such as fatigue or muscle pain. Meanwhile, in prostate cancer, there wasn't necessarily a difference between any of those hormone therapies. And some ways that I found to help relieve these side effects within patients. For breast cancer, dietary adjustments can be used, such as taking out spicy foods, reducing sugar and alcohol intake, developing a routine, like taking your hormone therapy pill in the morning or night. Having that set routine helps the patient feel better and helps boost psychological motivation. And also, the administrators or physicians can let the patient take breaks from hormone therapy and adjust their dosages. In prostate cancer, patients can change their lifestyle, such as quit smoking, reduce their alcohol consumption, or increase their resistance exercise. They can also increase calcium and vitamin D intake, exercise more. And for patients with erectile dysfunction or decreased libido, PDE5 inhibitors are generally prescribed by physicians to help with this. And then for the conclusions, the side effects and mitigation of hormone therapy on breast cancer and prostate cancer, the contribution would be to make management strategies for physicians and families, advance research within this field, and inform patients and their loved ones on different types of hormone therapies, the side effects, and what routes they may want to choose. The limitations that I found in my research included race, age, and lifestyle, and genetic disposition. Everyone is different, and the way their hormones work are different, and the way that hormone therapies will work on an individual is different from someone else. So that was one limitation I found in my research. And acknowledgements to Dr. Paralajuli and Professor Virgil for helping me with all of this. Professor Virgil helped me with seeing the format, how to do my citations, how to structure everything. And Dr. Parajuli helped me get my sources, also helped me with furthering my research, not just limiting to like one cancer or just the side effects, but also listing like what it is, etc. And also a big thank you to Coach Joe and Gifted Gabber for giving me this opportunity to partake in this wonderful research program, because I've learned a lot. And not only will it help me with my competitiveness for the future, but also advancing research science and in the medical field. So thank you.
Amazing, Kushi, and thank you for the kind words. You can stop sharing. I just have to remind myself that you all are high school students, right? So that's something that I have to tell myself when I come to the final presentation, because that's how confident you guys are in presenting or having done the research. So a big round of applause to Kushi and everyone who's presented today. Dr. Prahalad, question for her.
Yeah, so Kushi, with so many side effects, did your research also lead to you, or did you think during the process that there could be some alternative therapy that could be like equally effective but have less side effects?
Yeah, that was one of the research topics that was in my paper for the future of HT, because there are some new hormone therapies such as CDKA4/6 inhibitors and P13K inhibitors, and those are being tested right now. So I think as time unfolds, the future of hormone therapies will show the results and hopefully relieve these negative symptoms within patients.
Wonderful. Yeah. Great job.
Excellent. Excellent. Keep up the good work. Two questions for Kushi.